Okay, so here are my key findings from the 30-year longitudinal study into parent-child interactions. And to keep this as brief as possible, I'm just going to gloss over some of the paragraphs. You can pause the video and read the content yourself, because if I were to read through them all, this video would be 5 times as long as it needs to be. So yeah, here we go. So here we have the study confirming that overall the data confirms Bowlby's hypothesis of attachment theory regarding the quality of care that a mother gives to the child is directly related to the quality of attachment that child subsequently has towards her. The mothers with more securely attached children were more cooperative and sensitive with their infants in feeding and in play, and also that the mothers were more responsive to their infants' cries, more sensitive in pacing and timing of care. And it's saying that these findings are well established now. Okay, so if we go down a bit further to this paragraph where it starts on page 100. Now they're confirming that the amount of cries that a baby or child displays upon being separated from their mother, the intensity of that crying regarding resistant and secure attachment styles, isn't really a factor that can be used to judge what type of attachment style they have, but rather when the mother returns and there's a reunion, how the child's ability to take comfort in their parents and be soothed by their presence and return to a normal state where they can get on with playing or whatever they were doing before, that is the hallmark of a secure attachment. And also to say that the comfort and consoling aspect of reunion between a caregiver and a child outweighs temperament. Okay, so let's go off of secure attachment. Let's go down to the Cooperative-Interference Scale. Here we have the Cooperative-Interference Scale. This has proven to be a very important finding, as we just mentioned, that children who are securely attached, their parents are more cooperative, they find out what the child is doing, what they're working on, and help and guide them in what the child is actually active in, so that they can build up their understanding of whatever they are interested in, as opposed to an interfering parent who is always breaking into the child's attention or whatever they're doing, whether they're playing or trying to work something out. The parent comes in, cuts across their attention, gets the child to do what they want them to do, or just completely pulls them out of that situation and places them in another one. The difference between being an interference with the child's attention as opposed to cooperating and nurturing whatever that child is attending to. And as you can see here, it's related to really quite serious findings. 1 standard deviation or drop in boys' achievement in grade 1, and the development of attention deficit hyperactivity disorder and other attention problems on a clinical level, and later academic success in the teen and early adult years. And also you can see here that it's strongly linked along with malevolent care to the most serious of the attachment styles, the disorganised attachment, which represents the most dissociated and troubled state for a child. And of course how resistant attachment leads to anxiety disorders, and avoidant attachment leads to conduct disorders. These two attachment styles have very different developmental pathways for the mental health of those children that have them. And here we have how intrusive and insensitive caregiving is related to greater under control of the emotions and less flexibility, age 4. It also mentions here how boundary issues really early in life are highly correlated to those same boundary issues in a parent and their child in their teen years. It doesn't say it here, but other parts of the study show how when a child's boundaries are violated, that those children then go on to violate the boundaries of their peers. Yeah, it's really quite a serious one. Okay, so let's just quickly finish up on another very important finding of attachment theory. Here we have psychological unavailability. This initial paragraph describes the 4 different types of maltreatment which are covered extensively in this 30-year longitudinal study, and how psychological unavailability was an especially important finding. It involves a complete lack of emotional engagement or emotional responsiveness to the child. The mother is either effectively flat, that means emotionally flat. Affective is used to mean emotionally here, so the mother is either emotionally flat or simply does not resonate with the child's emotional expressions. It is the psychological counterpart of physical neglect. So really they're saying that this is psychological neglect or emotional neglect. Yeah, let's go down to some findings, key findings. Here we go. So here going into a little bit on general maltreatment, how early abuse is very highly correlated to behavior problems in adolescence. It says here, membership in any of the maltreatment groups was in each case related to significant problems, and in each case predicted the likelihood of some psychiatric treatment. 90% of these children qualified for at least one psychiatric diagnosis by age 17. That's an incredible statistic. 90% of all maltreated children had at least one psychiatric condition by the time they were 17. The figures are astounding for comorbidity rates for having 2 or more psychiatric conditions as well, but we'll go on for that in a moment. Here we go. It says, every form of maltreatment was related to delinquency, with a history of psychological unavailability being the strongest. I mean, have a look at this finding. Every form of maltreatment was related to delinquency. Every form, with a history of psychological unavailability being the strongest predictor. I mean, these are incredibly important findings. Many of you may know that suicide is now the most common cause of death for men aged between 20 and 50 here in the UK. And here we have the findings that psychological unavailability is associated to elevated suicide attempts. So it's a risk factor. Okay, so here we have the maltreatment comorbidity rates of the study, of the 30-year findings of this longitudinal study. This refers to the participants having 2 or more diagnosable psychiatric conditions by the time they're in their late teens. And you can see that psychological unavailability is on a par with sexual abuse. So it's a very, very serious finding. And under this we have some of the final conclusions of the 30-year findings, and I'll just read them out to illustrate how much of a revelation these findings were. Okay, within the area of child maltreatment specifically, a finding that we could not have anticipated based on previous literature was the devastating consequences of psychological maltreatment. The pattern of parental psychological unavailability had wide-ranging consequences from early childhood on into adulthood. I mean, one of the most potently damaging things that can happen to a child is psychological maltreatment or emotional neglect. That is the findings of the most eminent study we have on parent-child interactions.